I enjoy working at MDH because it's a smaller hospital.
It's just a great environment to be in.
These people are amazing and my boss is amazing.
We help each other out. It makes the working environment more enjoyable compared to other places I've worked at.
It's not just like the people that I work with, but everyone in this hospital. They're all very friendly, very kind, very receptive to outsiders and new people.
You know, work is not just about the job, it's also about the people that work alongside you. And we have the best teamwork. They're like a second family. And sometimes you can't get that feeling other places.
I believe our departments here are very cohesive because we are a relatively small community. So not only do we know each other through our professional roles at McDonough District Hospital, but we very much see each other in the community as well. And so I think we have a strong respect for one another, our diversity in backgrounds, but yet all coming together for one common goal, and that's strong patient care.
Working in the emergency room is different from any other part of the hospital because I do a lot of hands-on patient care in a very high-paced, high-energy setting. You see anywhere from a stubbed toe all the way to really intense patients like cardiac arrest, so it's a huge learning environment. We never see the same thing twice, even if they come in with the same complaint. There's always an opportunity to learn, even with your stubbed toe patients.
In the emergency department, if you want to really use your nursing skills and your critical thinking at work, ER is definitely for a new grad. Working here just for the past couple months as an actual nurse, I've used a lot of my nursing skills I've learned in nursing school, and I've used a lot of my critical thinking skills. It just makes me feel good about myself, being able to help people that need help, that need to be taken care of.
You get the opportunity to see so many different things that if you worked at a bigger hospital, you may not be able to see. So that's probably what I think is most unique. We have a lot of travelers that come here and they're like, oh my gosh, you guys get to do that? Or wow, you get to see that? And I'm just used to the, level 4 and 5 and the more what we would classify as the more simpler patients, not the more complex and in-depth patients. So I think that's what's the most interesting part.
Working in acute makes it so special is the bond that each of us share. We all have a close-knit bond, especially with the ones that I started working out with when I first became a nurse, and the teamwork is tremendous.
Working on acute care as a new graduate would be a great learning experience. We see a wide variety of patients, surgicals, orthopedics, general medical, heart failure, diabetes. It's a wide variety that gives you a lot to learn from. Your basic nursing skills that you learned in nursing school will be used on acute care with all the different patient population, and to put what you've learned in a skills lab to practice with your patient population.
We have a great team of nurses that work in home care. Sometimes in home care we get into some situations where the level of care is very high at home and there's a lot of resources needed, and just setting up a total plan to meet the patient's needs, that's where the nurses need some help. They can care for the patients extremely well. Nurses who work in home care will tell you one of the biggest satisfiers about being a home care nurse is the variety of patients that you see. In one day's time, you may visit a person who has a chronic respiratory illness, then a person who is a cardiac patient, then a wound, and then maybe a new ostomy. So the skill set is a varied skill set, but that's also the same thing that really entices some nurses because they feel like they are always learning and they're getting to use many, many skills and not just in one specialized area.
I do pre-op and post-op in the surgery department, and what makes it special is we get a lot of one-on-one time with our patients when they're awake, and I guess when they're asleep too, but more importantly when they're awake. I get to hear their stories, who they are. I'm not from this area, so it's really interesting for me to have that one-on-one time with them. So yeah, I think that's what makes it most special. The thing about surgery, especially at MDH, you know, a lot of our surgeries are outpatient. So we're scheduled 7 to 3:30. So typically we're here early in the morning and then we leave by 3:30. So it's nice, 8-hour shift, Monday through Friday. We get our holidays off and weekends off usually.
I chose surgery because I really liked human anatomy. That was one of my favorite classes. During nursing school, I got to observe a couple different surgical procedures, and I just loved it. So in surgery, you have to have a lot of teamwork because there's many different areas that are providing care for the same patient. Surgery, you don't learn that in school. Like you learn everything on the job. So when you're starting out with nursing, like you're fresh, you don't have, you know, like you're just a sponge ready to absorb. And I think surgery is the perfect place for that.
ICU is special because the patients are a lot more ill than they would be on acute care, but you also have lower patient load. So it allows you to really focus in on each patient's care and be able to really take your time with, you know, the drips and whatever the treatment plan is. The excitement about coming to work every day is absolutely, you don't know what's going to be here when you get here.
It takes a special person to be able to jump right in and dive into ICU from the get-go. I mean, I've seen people do it. I've worked with great nurses that have done it, but in my experience, I enjoyed working in acute care, getting my experience, and then cross-training as soon as I can. You know, don't be scared to volunteer and say, I'll do that, let me cross-train. Don't be scared to do that. Just always be willing to experience different things.
I think my favorite part about being in staff development is being able to mentor and collaborate with all the staff, getting to know all the faces of all the staff and be able to work with them to watch their growth. Also knowing how to educate, being able to educate in different ways. You know, people learn differently. Some people are going to learn more auditory, some people are going to need to do more of the hands-on tactile skills. So just being able to adapt that orientation to be able to provide the education where they're going to get the most out of it. I think the biggest thing is being a resource for our staff throughout the orientation, as well as, you know, we're still there as a continued resource throughout their whole employment to be able to continue their education.
OB is the best job I've ever had, probably the toughest job I've ever had, just because it can change on a dime. Everything can be going fine and then all of a sudden it's not. And you have to be prepared for that, and you have to be prepared to care for 2 patients at once, one that you can see and one that you can't see. I've had my babies here. I've had one of my babies in this room almost 14 years ago. It's just an incredible amount of teamwork that goes on. It's an incredible amount of trust, and most of the time it's fun to see a new person come into the world and, you know, celebrate with those parents.
OB is exciting, and you never know what can happen and what can walk in the door, but at the same time you get to really give total holistic care in OB, as in you get to really see the emotional side of patients, and then you also get to help them physically too. So it's just a really good feeling. I look forward to having my babies here someday because I know that my coworkers / good friends are going to take amazing care of me, and I know the providers will completely support me and my baby as well.
We hope that future nurses of MDH will choose us, and those who are already here will want to continue on because we have such a strong sense of team, whether it's the teamwork within a department between shifts or interdepartmentally when they do a handoff between one department to another. It's just a very strong sense of team and support for one another, and a great respect for everyone's various roles, because it takes the whole team for all of us to be successful and for the patient to have a good outcome.